everybody, it's Maggie, and I'm just wanting to come on back online. I feel like I've risen like a phoenix. The last couple of months have been pretty tough for me. I'll go into that with you, but first and foremost, I want to say thank you to all my friends, my family, my kids, cousins, things like that, who called in or sent me messages through Facebook, through Messenger, through text messages, through my phone. Co-workers of mine who have watched me battling what I was going through to make sure that I was okay, and wishing me well and sending me prayers and all kinds of things. And I just want to say thank you so much from the bottom of my heart. So let's get right to what happened. I started my YouTube channel and Instagram, and it was off to a bang. I was sharing recipes, losing weight, exercising a lot, having a great old time. And then really seems to be moving forward. And then all of a sudden, wham, I got hit with a headache. And I thought, okay, well, here we go. I have a headache, I'll treat it, and I'll get better. That headache lasted for 28 days. I do keep a headache journal for when it happens, because I do suffer from chronic headaches. And we'll go, that's the next thing that we're going to go into about women and headaches. You know, I like to educate you on women's health, so here we go. This is going to be a little bit lengthy, so pull up a chair, grab a cup of coffee, cup of tea, whatever you like to do, and come join me and learn a little bit more about what I can offer. What I'm about to tell you are things that have been proven and based on clinical research through Tufts, through Mayo Clinic, through headache clinics all across the United States, and even some in Europe. So let's just start with women and the headaches. And I want to let you know that women suffer from pretty much two types of headaches. The hormonal headaches, which are pretty self-explanatory. These are caused in women at various points in their life from menstruation, lactation, pregnancy, contraceptives, menopause, anything that can cause an issue with that estrogen going down. They take a dump, and our estrogen's levels trigger various things that go on in our body, creating these hormonal headaches. People can recognize them because a lot of times I hear women say, well, I can tell when I'm going to get my period, or husbands or boyfriends or kids will say, I know when my mother's at that time of the month because she's a real crab. And if y'all know me well enough, y'all know I'm a labor and delivery nurse, and I work in women's healthcare as well. I've worked in the women's OR, I've worked in with physicians, high risk obstetrics, things like that. I've also been through it myself as far as needing eventually to have a hysterectomy. So I worked with some of the doctors on things that go on in our bodies, for women's healthcare is so important to me. All I can say, I'm going to say about the menstruation headaches and the hormonal headaches is, if you're suffering, women, do not suffer. Ladies, you do not have to suffer. Get some help. Go talk to your doctor. If your doctor's not listening, then you find another one. You go see a headache clinic. Headache clinic's great. Lots of updated research. They a lot of times work with the military too, and with some of the top neurology departments in the country. So please, go ahead, go talk to your doctor. There's lots of things you can do, from hormone replacement to biofeedback, alternative medicine, and actually some other medications that are available to you. What we're going to delve more into is the second type of headaches that women get. And it's kind of a combination of tension headaches and migraines. Migraines have become the catch-all phrase for everybody who gets a headache. Well, I get migraines. Well, I get migraines. Well, I get migraines. Well, I get migraines. Let me start by telling you, this is going to be a little bit lengthy. So like I said, pull up a seat. Tension headaches will generally start from different causes. Stress can cause it, kids can cause it, jobs can cause it, anything. Even things like allergies, sinuses, colds, anything like that can trigger a tension headache. A tension headache eventually will be a band around your head. People describe it as being in, my head feels like it's in a vice. The thing about tension headaches is they don't usually present with nausea and vomiting. And that's a big clue into you. Things that are helpful for tension headaches is physical therapy, behavioral health, relaxation, meditation, stretching, exercising, yoga, medications such as the SSRIs can, if you have chronic tension headaches, or a TENS unit, Motrin, Naproxen, the NSAIDs, those help. Aspirin, again, those help. I'm not saying take medications without checking with your doctor, because of course you all know your own medical backgrounds. Before you take any kind of medications or any treatments, please check with your physician. Now moving on to the next, with a tension headache can indeed form into a migraine. It is not the same kind of a headache, okay? Migraines generally will have a tension headache attached to it, like 80% of the time. Tension headaches don't always evolve into a migraine, but if you have a migraine, the chances are you've got a tension headache either that led up to it or a tension headache that is running concurrently with it. So you'll have a migraine headache and a tension headache coming together in your head. Old research kind of showed, and the thinking was that migraine headaches were caused by blood flow issue in our brain. New and modern education, research from some of the top-notch places across the country, across the world, the best neurologists, headache clinics, research departments, Harvard, UCLA, over in Europe, there's amazing. Anything in the military, the United States military has mega studies and research done on head injuries and headaches resulting from head injuries. And of course, a traumatic brain injury can also be the cause of chronic migraine. Most migraines sufferers, if they look in the background, there is a familial effect to it. There is somewhere come down the line where migraines are hereditary. Now, that's not 100%, because in every family it has to start somewhere, right? Yes. And that doesn't mean that 3 or 4 generations back you didn't have somebody who suffered from migraines in your family and didn't know, and somehow it skipped these generations. So let me tell you a little bit about migraines. 15% of migraines will present with an aura being zigzag lines. It's prodromal is what it's called. But we'll get into that afterwards. Usually they're unilateral. Again, 15% of people who have migraines will have bilateral, meaning both sides. They generally are throbbing. They get worse with activity. You'll feel nausea and vomiting. You get photosensitive. You get sensitive to sounds and to smells. The real important thing is you need to get to know your triggers. What triggers it? Believe it or not, caffeine is a do or die. It's either it's going to trigger your migraines or it's going to help your migraines. Take my family, for instance. Caffeine is one of the number one things I go to with a migraine. And yet my son, Brendan, can't have any caffeine at all, because if he does, he could trigger a migraine. So it just goes to show you that each person, even in the family, is very individual. Very important, again, to see your physician, okay? Alcohol, stress, change in sleep patterns, hormones, weather changes. A lot of people will have triggers. One of my biggest triggers is a drop in the barometric pressure outside. If it's going to rain, a lot of people you'll hear, oh, I got arthritis, I know it's going to rain. Me, if I get a headache, there's a certain type of headache I get, and I know days in advance that we got a storm coming. And I start medicating then. Changes in your diet. Have you changed anything? Have you, like I did, dropped down and gone on to a keto-style diet? Have you gone low calorie? Have you become diabetic? Things like that. Dehydration, another thing. Certain lights, LED lights, smells that can trigger it. It's amazing the things that can trigger a headache. There's two different types of headaches. One would be the classical migraine. And the classical migraine is a migraine that presents with an aura. And then the second type is the migraine without an aura, and that's called a common migraine. Some of the stages of headaches, of migraine headaches, are the prodrome. The prodrome is can be from hours to days before a headache hits. 60% of the people will have it. That's where you get sensitive to lights. You notice in that you don't want people talking so loud around you. Certain smells, you're like, ugh, what is that? And it could be a smell that you love. Fresh mowed grass, you know, cooked bacon, coffee, tea, whatever. Things you usually love, and all of a sudden it's like, oh God, I gotta get away from here. Mood changes. Mood changes are big because you know what? Now you may be starting to have some interruptions in your sleep. Thirst. You can get extremely thirsty. Some people get very bloated, and some people become constipated. Some might get diarrhea, and this can happen for days. And a sense of exhaustion, like all I want to do is I can't stay awake. I'm not really tired all of a sudden per se, tired that I need to sleep, but I don't know why my body is so fatigued. You might sit on the couch and the next thing to watch a show, and the next thing you know, it's 3 hours later. The next stage would be the aura stage. The auras can be visual. They can be auditory. And some people actually, they'll see lines and dots and flashes. Some people actually can even hallucinate, like as if they see something running across in front of them, like a cat dot in front of them, or rapid movement, and there's nothing there. How many times have you, before a headache, jumped, oh my God, what was that? And everybody around you is like, what? You know, well, that could be part of your aura. Tunnel vision. How many people can just pinpoint, all of a sudden you can't see around you, you got these little pinpoints and you're like, oh, where is everything gone? Other people do the absolute opposite. Like, as a labor and delivery nurse, it is vital for me to be able to read a fetal monitor strip. Those fetal monitor strips tell me what's going on with that baby that I can't get my hands on. So when I'm getting a headache and an aura hits, I don't get pinpoint vision, I get wide vision. So I can see around, but I can't see in. I can't see that middle part right there, so I can't focus. Some people have trouble speaking. You trip over your tongue. You can't remember what you're going to say. You're like, People you've known forever, and you're looking at them and saying, I know this person. How come I can't remember their name? You know, and you know that could be your brother, could be your sister, could be your cousin, your best friend, your neighbor, your dog. You don't know. All of a sudden, the name is gone. It's just not there. It's very common. Don't think you're weird. Don't think something bizarre. And then ringing in your ears. Auditory. You could be ringing in your ears. You could get something like playing a game online and you blow something up and all of a sudden your head just goes whoosh. You know, you'll get this like almost rush in your head, like an equilibrium change. And this is something that happens. That can all be part of auras. And then the actual attack. Now, auras usually last 20 to 30 minutes and then they're gone. But it could be hours before a headache. It could be immediately before a headache. And of course, then there are the common migraine, which people won't get. They skip that stage totally. Then there's the attack. This is what we all who suffer from migraines hate. It's where the pain hits. It starts as a dull ache. It grows to a throb. It can move it may start here, it moves over here. And there's no cut and dry form of the types of headaches that there are. Usually migraines generally will last about 4 hours, but they can go on for up to 3 days. And the problem is though, now with this, it's not uncommon for people who suffer from migraines to have 2 to 4 a month, generally, normally. But then you have your other people who, when combined with other headaches, you've gone to more than 15 headache days a month. and that's crippling. That really interferes with your life. Then you have your post headache, which is very similar to somebody who has seizures and has a post-ictal kind of symptoms. You're tired, you're wiped out, you could be cranky, you may have muscle cramps, food cravings, you may totally lose your appetite, but you want to sleep, you feel very weak. Sometimes, you know, you don't even want to get off the couch to go to your bedroom. You don't even want to get out of your bed to go to the bathroom because you just feel like, I just can't move, I have no strength. That's all part of the makeup of the migraine and the stages that go along with the migraine. Now, like I said, it used to be thought, the old thought process was that it was a blood flow, but the new research is showing that what happens is that overactive nerves in our head actually trigger our trigeminal nerve, which actually controls our facial muscles and our head muscles. And when that gets stimulated, when the trigeminal nerve gets stimulated, it releases this huge massive dose of serotonin, which is our mood stabilizer in our brain. And also the calcitonin guilt-related peptide. And what happens is when that happens, those get released into our blood vessels, into the lining of our brain, what happens is that causes swelling to happen. And there you go with your headache. Now you've got your migraine. One-sided, it's inflammation of the blood vessels in the lining of your brain. And they're finding out really was beyond the blood flow. It did indeed have something to do with the blood flow, but it had something to do with what was in the blood flow, which now they've been able to really trigger. So we have a whole new family of medications and treatments that we use and using successfully to help people, especially women who has so many things that rely on them to be able to function in life, to be able to take care of our kids, do our jobs, run our homes. And now at least we have some answers. And we don't feel so hopeless. We're not like, oh, it's just hormonal. It's not hormonal. It's not because we're women. It's because we legitimately have an overstimulated trigeminal nerve that is letting go all of our, all these chemicals into our brain that are triggering the headache. Women get 3 times more migraines than men. Usually the age goes from about 10 to 40. You'll see girls prepubescent who start with migraines. I know some of my great kids, unfortunately, suffer from them. What a wonderful thing that I passed on to my children, and believe me, I feel so horrible about it. Family history, 4 out of 5 sufferers are hereditary. So that just goes to let you know that if you have migraines that run in your family, take them seriously. When someone is complaining, one of your children, whether they're 10 or 9 or 13 or 17 or 20 or 30, and they're telling you they've got a headache that is so crippling they can't even move their head off the bed. These are things that need to be taken care of. Medical history, for instance, is another thing that we find that can cause, through research, that can cause it. Depression, anxiety, bipolar, sleep disorders, and epilepsy can all trigger migraines and cause issues for those of us who do suffer from them. The other area I'm going to just touch on is the types of headaches. Like I said, the hormonal and menstrual headaches. Then there's the silent migraine. The silent migraine will give you an acephalgic migraine is what it's called. It's an aura without symptoms. It lasts about 20-30 minutes. Basically, you get a headache without pain, but you get the pressure, and you know, and you're waiting for the pain, and you're expecting the pain, but the pain doesn't come, and then the headache goes away on its own. You still have had a headache. It's just not a crippling one. The vestibular one, that really has a lot to do with people that have vertigo. They'll suffer from vertigo, balance issues, nausea, vomit, And it can be with or without a headache, again. So we never know. Children tend to suffer from things. A new headache that they don't know much about is an abdominal headache. So if your child comes to you complaining of a lot of pain in their tummy, it might, believe it or not, it could be a headache. That kind of grabbed me too. Like, this is a headache, this is a head. But I'm sure it's just for lack of, what else are we going to call it? But kids describe it as, I feel like I have a headache in my tummy. And it's new, it's being researched, so it'll be interesting to see what the research shows. The other, ocular, very similar to a focal seizure. Short-lived, very short-lived. Usually it's partial or total loss of your vision, where a lot of times the oculars will come in addition to other types of headaches. And this is one that I suffer from, an ocular headache. Remember I said that I get that where I can't see in the middle, I can see around. And a lot of times it's both sides. And an ocular headache can happen either unilateral or bilateral. So again, very up to the patient, the person who's suffering. Migraine with a brainstem aura, which is that people get dizzy, they get confused, they have loss of balance. It's a lot in the back of the head, down in the back of the head. It starts very suddenly. All of a sudden you'll be walking and you'll be like bouncing off the wall and you say, oh, what happened? Then all of a sudden you feel like you just got clubbed in the back of the head, down by the neck. People can have trouble speaking. It's ringing in the ears and vomiting. That is, you know, another type of a headache. Then you get into the more medically emergent headaches. We have the hemiplegic migraine. Now, a lot of people will say, well, I feel, you know, numbness and things when I get a headache. That's normal for a migraine. That does not mean that you have progressed into the more severe headaches. Most migraine headaches you can get, write it out with no life-threatening issues or threat. But there are two that really can create an issue, and one is the hemiplegic migraine. Now, less than 1% of the world's population, not just a city, not just, you know, a country, of the world's population, less than 1%, suffer from them, and they generally have to be diagnosed by a neurologist after numerous testing. That's what brought me such interest in headaches, because I have been brought to the emergency room so many times, unable to speak, unable to move, and I can hear code stroke. I get whipped down to CT scan. I have immediate CTs done. Pharmacy is waiting in the emergency room with TPA to be able to give me that clot-busting drug to stop the progression of a stroke. To find out that I'm not having a stroke by usually the time I get out of CT, they've called my emergency contacts, which is either my son Brian, my daughter Kelly, and they tell them she's not having a stroke, she's having a hemiplegic migraine. I do get auras when I get them. So if I'm driving, I can pull over and say, I'm getting a headache, I need somebody else to drive. I can call home and say, I need somebody to Uber to me. You know, it's a dangerous thing. I remember one day I was talking to my boss in work, and I was in her office, and she said something. I went to answer her and I couldn't speak. I could just stare at her. I was like, and then the lip dropped. My lip went down, my eye went down, I slooped in the chair, I couldn't get up, I couldn't balance myself. I went to fall out of the chair, she jumped up, grabbed me, was holding me, they got me in a wheelchair. Code stroke being called, and down I'm going because now I'm drooling and everything. Lasts about 20-25 minutes. It's a scary time, and it's a scary time for the person who suffers from them too. Believe me, because you're not sure, especially with my cardiac condition, you know, am I really having a headache or am I truly having a stroke? So it's something we really need to take care of. If you are one of those 1%, or if you think you're having a stroke, please don't hesitate. Have your friends, your family. If you can call 911, if you have a life button, hit it. Go to the emergency room. Make sure that you're not having a stroke. Okay? This is why it's really important to not just brush off headaches. Migraine headaches, you need to make sure that you know exactly what kind of a headache that you're having. Okay? The other one that is a scary one is called, and I may not pronounce this one right, the ophthalmologic migraine. It's pain and paralysis around your eyes. People can't keep their eyelids open, and you can't squeeze your eyes shut. Your eyes are like wide open, like bug-eyed. And it's a medical emergency. This is caused by pressure on the nerves behind your eyes, and it could be a sign of an aneurysm. So again, 2 headaches that could be life-threatening: the hemiplegic and this ophthalmologic migraine. That one was a new one for me, but I've been doing a lot of research because I'll tell you in a moment. If you start having droopy eyelids, double vision, or changes in your vision, and you can't close your eyes or your eyes are paralyzed, just get to the ER. Call 911. Go. Have somebody take you immediately. Okay? So that explains the migraines and the headaches that women suffer. Unfortunately, there's no cure. No cure for any of them yet. We can treat the symptoms. We treat the symptoms with various things. Like I said, with the tension headache, we can treat it with medications and biofeedback, things like that. Migraines, dependent on the migraine, is how you get treated. 90% of the time, you can just ride it out. Medication for pain and ride it out. Other ones, like the status migrainoris, those are severe enough to land you in the emergency room, and the only thing that's going to break the headache is IV medication, whether it be Toradol, Reglan, various other medications that they can use through your IV. That's not opiate. It doesn't mean you need opiates. I can't remember the last time I had a pain med for my headaches, and I'm actually well under control. So that's where I ended up going. I had a headache. It wouldn't go away. It started combining with, I started with just a classic migraine. I had an aura, and it was, I knew I was getting it. I was able to still go to work. I was uncomfortable. I wasn't my cheery, happy-go-lucky self. I was very quiet. They all knew. But then my blood pressure went up, and in response to pain, everybody was afraid because we all know about me. And so I went to the emergency room just to check it out. And I had a whole cardiac workup to find out that I had a hypertensive response to pain. Now, that still could have been an issue because of my blood pressure that high. I could have thrown a clot and definitely had a stroke. So it's really important that you make sure you go to doctors. They're not the bad guys. Some of the things that we can do for our headaches. The way they're listed is episodic. People get them every now and then. High frequency headaches. People who suffer from high frequency suffer from 8 to 14 headaches a month, or headache days a month, I should say. And if you have somebody like me who suffers from true chronic headache, migraines, various migraines, it's 15 or more days a month. There's different treatments for each one. For me, if you have over 15 days a month that have at least 8 of the features that I mentioned, then you are considered a chronic migraine sufferer. And that is where insurance will kick in to these higher types of medications. Very rare migraine is called the migrainous infarction. And it's not really a particular migraine, but it's something that can happen with those last 2 that I told you about. And what it is an infarct. It's where something goes really, really wrong, and basically you do have a stroke during the migraine. So you need to really be careful. You know, it's rare, but it happens. Hemiplegic migraines, like what I have, they can lead to a coma, or worse, you could die from them because you won't know that you have an infarct because you're thinking you're having a migraine. Another thing is you cannot take the triptans, the Imitrex, and various medications that a lot of people hear about, the self-injectable kinds of the triptans, because those could actually cause you to go into a coma, cause you to have an issue if you have hemiplegic migraines. So those are things that your doctor will discuss with you. Basically, it's pain relief, antiemetics to keep you from vomiting, like Zofran and Phenergan, the triptans for regular migraines, the common migraines, the classic migraines, any of those other ones, the focal ones, those will respond well to Imitrex and the newer drugs of the same family and line that are out. The ergotamines is another one that works really well on your brain, the chemicals in your brain, to help bring down any of the misfiring that's going on and dump in loads of chemicals and hormones into your system that are going to go and inflame everything in there. Lasmiditan is a medication that brings down nausea, brings down the photosensitivity, and the hearing sensitivity during a migraine, and sometimes that's all people need. We have the CGRP receptors. Remember I told you about the calcitonin and the serotonin that are the things that are dumped into our systems when the trigeminal nerve gets fired up. That's what causes the swelling in the blood vessels in the lining of our brain. And we can take medications. Those are called the antagonists. And what it is that the CGRP receptor antagonists, which of one I take is the Ubrelvy. Well, as soon as I feel the headache coming, I take an Ubrelvy. If I still have the headache, 15 minutes later, I take another one. Generally, 2 will help. And this is after some of the other things that I'll tell you, things that I do. The SSRIs, the serotonin reuptake inhibitor drugs, that can help prevent you from blasting yourself with all the serotonin release from the trigeminal nerve. Those are daily medications that you take. Those are more preventative. Whereas the CGRP you take when you have the headache. The SSRI you can take on a daily basis to help prevent it. The other thing is there is the another CGRP drugs, which is injectable. It's once a month. I take it. It's called Emgality. There's another one called Enjovi that you can take. It's self-injectable. It's very similar to an EpiPen that you would give. You just put it in your tummy, push it in, and it goes in. Does burn, but I'll tell you, it's worth the 30 seconds of the burn to not have those crazy ass headaches. Beta blockers, calcium channel blockers are blood pressure medications that can help. Then you have the transcranial magnetic stimulation. Those big words, but it's a small little device. You put it on your forehead and for 20 minutes a day. And what it does, it's kind of like it's a vagal nerve and a trigeminal nerve relief. So what it does is that it releases magnetic energy into certain areas of your brain to help kind of offset all the it's almost like a computer rebooting. And your brain is all in pain, it's all swollen, it's all inflamed, and it just wants to go back to normal. And you can help it with things that are not medication. Go ahead and put it on. These things aren't bothering you. The other one is the neuromodulated devices. Those are like I said, the vagus and the trigeminal nerve ones. They can go on the back of your neck for the vagal device on the back, and that'll kind of put electrical impulses in through there into the vagus nerve. And then the trigeminal nerve, things like, they're like mini TENS units. Me, I have a big TENS unit. I just slap that on my face and it helps. sometimes when I have them, I'll go in here on my traps. I'll put pads here on my traps, and I put them too in the base of my neck up here, and that will help to avoid getting, or to keep it at bay until it goes away on its own. Alternative treatments, physical therapy, biofeedback, cognitive behavioral therapy, learning new ways of dealing with anger and stress and things like that. Acupuncture, acupressure, massage therapy. These are things insurances are really starting to become a lot more involved with, because they're a lot cheaper than going long range routes and much more expensive routes. It's a lot cheaper for them to pay $50 a week for you to go get a massage to help break up any tension that's going on that could go ahead and trigger a migraine that could leave you out and leave you in an emergency room for thousands of dollars. Because when you get, let's face it, we live in the United States. Those of us who live in the United States, we live in the most litigious country in the world. If you go into an emergency room and you're complaining of such severe pain in your head, and they cannot give you, even with IV, they can give you fluid, they are not going to give you any medication until they have ruled out that you don't have a brain bleed. $1,000 to $1,500 test right there, boom, for your insurance company. What's going to be cheaper, $50 for a massage a week or $1,500 once or twice a month? So insurance companies are kind of starting to wise up to this. There are other things. Something that I read about that I thought was interesting. It's a new device. It's a stimulator that comes out. It looks like a headband. And you put it on, and it's just little electrical pulses that go through. Anybody who's old enough, I'm going to date myself. Actually, Princess Diana wore one of those bands around. The hippies, like the hippies, my age, we went around. It looks like that. It goes on your forehead, gives little tiny electrical pulses in. Again, another stimulator to help relieve that trigeminal nerve. You put it on, like I said, every day for 20 minutes. It's great. Gamma core goes on the back of the neck. These are the things that are all now available. So anyways, prevention, the biggest thing, try and prevent it. Manage stress, take your daily medications, avoid the triggers. Figure out what your triggers are. There's certain triggers you're not going to do anything about. When a storm is moving in, you can't do anything about the barometric pressure. If you're getting your period or something, and you can't do anything about them hormones going down. But you can eat on schedule. Make sure you get sleep. Get out and walk. Just, if you have a dog, take the dog for a walk. Quick walk. Nobody says you have to go walking for 2 or 3 hours. Take the dog out for 20 minutes. That's all it takes. Just give your body something to work with. Anyways, I went a little bit over. I had figured 25 minutes. I am at 37. It'll be 38 minutes. I hope that I still have you with me. I hope that this is helpful to you. Please feel free to contact me anytime with any questions. I'm more than happy to go ahead and help you to figure it all out. Okay? Anyways, God bless you. I hope you're feeling better. I'm better now because I had my Emgality. I did fly back to San Antonio because it was going to take too long to get seen here in San Diego. I went and I saw the headache clinic. Thank you to Anna Castro. You're great. You have really given me back my life again right now. The Ubrelvy, I did get 200 units of Botox. It goes in here above your head. Like, it does go up here. I'm not saying I'm not enjoying the fact that I have a little Botox up here. Not that I have any wrinkles up there, but it's kind of nice. But up in here, they go into here in the top of your forehead, through your scalp line, down around your ears. They go down your traps. These 2 traps here, they go in there. Yeah, I can see them now with the weight loss. Ooh. They go in there, and then they go across the back between. And 200 units of Botox. It's all covered by my insurance. I have seen that bill. That bill is $5,500, so thank you for insurance as well. And then the Emgality, I took the shot of Emgality, and I have a Ubrelvy that I have in my pocketbook. In my bag. I have some in my work bag. I have some in my car. And I don't hesitate to take it. It's better than being in the house in pain and agony. So anyways, I'm going to head out. I'm starting to look through recipes. So if you're ready we'll get back on the road shortly, okay? I'm gonna get everything going, get everything set up again. And I love you all. Like I said, feel free to contact me. Any questions? I'm more than happy to share my notes. As you can see, I do a lot of research when I'm doing things. I want to make sure I'm giving you up-to-date information. All my stuff is from published articles, peer supported articles through Harvard, through Medline, through the state, through the military, through Tufts, UCLA, you name it. Being a nurse, I have access to the medical library, so it's really kind of neat to be able to look at that. I go a little bit more in depth than Dr. Google. So, like I said, please feel free to give me a call on here. You can, those of you who are on Facebook that I'm friends with, you can go ahead. Doesn't mean I'm going to answer because I work the night shift. If I don't answer, leave me a message. More than happy to answer questions. Definitely text me, okay? And anybody who wants to send me an email, it's MaggieWatsonRN@gmail.com. Please feel free. You can send me your messages and anything through that too, okay? So anyways, you have a great day. I just got back from work. I probably look like death warmed over. So I'm going to go get some sleep. God love you. Bye-bye.